Thank you. So I'm a registered learning disability nurse, clinical project coordinator in the Adult Learning Disability Health Service in Bristol, North Somerset, South Gloucestershire. Can we have the next slide? Yeah, and so I'm going to touch on reasonable adjustments today. Can we have the next slide, please? I want to look at kind of what they are, what they look like in practice, and consider some methods of how to think about how to implement them as well. So kind of first of all, back a slide, please, sorry. What are reasonable adjustments? Can we just, thank you. So they're a legal responsibility for health services under the Equality Act, and as kind of previously covered within the webinar, the learning disability population at greater risk of health inequalities, mistreatment, and poor health outcomes. And there's a recognition that not everyone is the same or has the same ability, and that people with learning disabilities are less likely to be able to access healthcare without adaptations. And so we use reasonable adjustments as a way of leveling that playing field for people to access health services. So what do they look like? Well, reasonable adjustments, if you go to the .gov website, you get these large, broad reasonable adjustments like physical adaptations, ramps and rails for access to buildings, or policy and training to help staff support a specific group of patients. But it doesn't have to be big, it doesn't have to be grand, and quite often it comes down to our own individual practice, and we need to consider the individual needs and how we can adapt our day-to-day care to meet the person's needs. And quite often it's those small changes that we repeatedly put in place that can make the biggest differences. So next slide, please. Thank you. So yeah, this is just a plug really for Health Innovation Network video on reasonable adjustments. It's on YouTube. The link's in the slides, and then you can go watch that after this as well to find out some more. Next slide, please. So learning disability services, we're often really good at telling the wider health services to just go and do reasonable adjustments, and we have this expectation that the whole health system is just going to know what they don't know, and you're going to know how to put in reasonable adjustments without guidance. So I want to take you through a bit of a tool, this acronym TEACH, which will help us understand how we can adapt our care and how to implement reasonable adjustments with some quite simple thoughts. So time. This is about time of appointments. So first of all, is the appointment at the appropriate time? Is the person able to make that time of appointment? Should we consider what the person's individual needs are? How do they access appointments? Is it via public transport, and are they able to get to the appointment time? When is there support with them, and is the support able to access them to access the appointment at the appropriate time? So considering that individual need of that person and the appropriateness of the appointment time, but also the length of time during an appointment. Do they need a double appointment slot in order to have that maximum time with a clinician in order to have a proper, robust conversation in a way that they understand, using appropriate tools that they understand? So time. And next one, please, is environment. So if you think of any healthcare setting, and then consider like a list of the worst sensory overloading environments possible, and most healthcare settings cover it. They're noisy, they're bright, they're busy. There's lots of equipment and posters and whatnot everywhere, so that we're starting everybody off on a point of heightened anxiety where they're feeling overwhelmed anyway by the environment. So how can we adjust that environment in order to maximize their ability to access healthcare? So we need to think about the sort of sensory impact of the environment, the noise and the lighting, and how can we reduce that where possible. So when we think about waiting rooms, is there a quieter space for them to wait? If they are finding the lighting overwhelming, can we reduce that lighting somehow? Perhaps find a side room for them to sit in. If they find waiting hard at all, can we get them to wait in their car, or can we have them arrive with an appointment slot ready for them? And that's where a double appointment could be quite helpful for them to arrive at that point in time. But also it could be other things such as how we presenting ourselves as healthcare professionals, and uniforms can be quite challenging as well. So just think about how we're presenting ourselves. Can we adapt our own personal presentation when we're thinking about environment? Next up, we've got attitude. So this is about our own approach to people with learning disabilities. So firstly, kind of educating ourselves on learning disabilities, and then applying that knowledge to practice. And then it's about confidently asking that person what they need, or their support, what that person needs, in order to identify how best we can adapt our practice to meet their needs. And then it's having a can-do attitude and just giving it a go, and having that confidence that making small adaptations to our care will make a big difference to that person. Next up, we've got communication. So this is all around how are we supporting that person with understanding everything that we're communicating to them. So from pre-appointment to during appointment to after appointment. And we need to make sure that we're communicating in a way that is accessible for that person. So starting off with like written information, so invite letters, it's already been said, making sure that we've got easy to read invite letters, but also things like ActRx text messaging. Can the person even read those text messages, or are we setting up for failure, or is a telephone call more appropriate? I had one service user who was never attending their GP practice because they all came through text messages, whereas actually she couldn't read them, and had they come from a telephone call, she would have attended. But also, are we maximising the use of our AccuRx text messages, and could we embed links in there to send to signpost to easy read documentation, which is available? The other thing that could help is thinking about videos and the use of videos within consultation. If we're trying to reduce anxiety around what we are supporting people with, there's a plethora of YouTube videos out there in supporting people to actually understand that following process that's going to happen. And then lastly, kind of we talk about easy read information, and definitely don't expect everybody to be experts in developing easy read information, but there is loads of materials already available. There's easyhealth.org, and some of the bigger charities like Diabetes UK or Macmillan, they have loads of really great easy to read information that you can access free on their website. So to have a look around and see what's available. And then lastly, on the TEACH acronym, we've got HELP. And this is about involving the person's support network in their healthcare, again, before, during, and after, and asking them to help the person to maximise their ability to access healthcare. But we do need to be mindful that we're not overlooking the patient, and that during appointments we are talking to the person, not their support network, and we're involving them in their healthcare. And then it's also a prompt to think about asking for help from the specialist learning disability teams. Again, advice and guidance from them. Next slide, please. So now we've just got a couple of resources that we've made locally in the BNSSG area. So this is a reasonable adjustments poster for staff in primary care, and this can sit behind the desk, it can be in your staff room, wherever you feel is appropriate. And these resources are readily available. We can share them out with a pack after today. Obviously, the links on there, they go to the local services. They're free to access. And this is some practical prompts for staff to think about on a day-to-day, before you see a patient, or just throughout your day, thinking about what can I do to adapt my current practice in order to meet that person's needs. And I believe we've covered a lot of that stuff through the TEACH acronym, but it's just another way of visualizing it. Next slide, please. And this resource, again, this is free, and we can share this with the packs. This is a slide deck for TV screens in waiting rooms. This is targeted at people with learning disabilities who would be able to access this level of communication, but also the support staff or someone that might be supporting someone with a learning disability to think, do I or does the person I'm supporting need reasonable adjustments? And I'll go ask a member of the practice staff to help if I do, and we can share that out as well. Next slide, please. So just to finish up, just a plug for the local learning disability teams. And if you are supporting people with learning disabilities and wanting to think about reasonable adjustments, and you're struggling to think about how you can adapt your care, get in contact with your local learning disability teams. In Sirona and BNSSG, we've got an advice and guidance line, which is staffed 7 days a week, that you can just call up and speak about an individual patient, or just more generally. And I'm sure that would be something that would be available across the counties, and I would highly recommend getting in contact. So that's me done on reasonable adjustments.